Hey, what's up, guys? I had a question in regards to one of the new next generation NCLEX item types, and it was the bow tie item type. And I just wanted to give you guys an explanation of the bow tie item type and then an example of what one might look like. So besides the new case studies and the next generation NCLEX, there's also two types of standalone items. And the two standalone items, they are going to be the bow tie items. And then there's also another type called trend items. So for this video, I will walk you through the bow tie item type. So a standalone item has a stated diagnosis or an implied diagnosis, and it can also include clinical information for a specific client. Finally, it provides components that require the entry-level nurse to make one or more clinical decisions. For bow tie items, the entry-level nurse must first read the scenario. It's going to end up being on the left-hand side of the screen and determine whether the findings are normal or abnormal. You'll want to comprehend the potential medical conditions or complications the client may be facing, and then formulate solutions to address the client's needs and concerns. The nurse will then answer the bow tie item on the right to ascertain the most probable cause of the client's issues. You'll want to determine the necessary actions to take and determine the parameters to monitor after the interventions have been implemented. The name bow tie item originates from the response area shape that you'll see on the right-hand side. It's resembling a bow tie with two actions to take on the left, two parameters to monitor on the right, and then a central condition most likely experiencing response. So to complete the bow tie item and progress with the exam, the entry-level nurse must fill in all target boxes with a corresponding token, which you'll see are located directly beneath the bow tie in labeled columns. So tokens from the same column can be swapped, but tokens from the actions to take cannot be used to fill the parameters to monitor targets, and also vice versa. The target boxes and tokens have similar wording and the same color coding to aid in correct responses. So, for example, the blue tokens under the potential conditions heading in the sample bow tie item on the page align with the similarly colored target areas above it that says condition most likely experiencing. This design helps guide the proper placement of the option tokens. So if a token has been placed on a target, it can be removed by either transferring it back to its designated column or replacing it by another token. The original token will then return to its proper column. So bow tie items may contain one or more tabs on the left-hand side. Some possible tabs that you might see on that left-hand side include nurse's notes, history and physical, laboratory results, vital signs, admission notes, intake and output, progress notes, medications, diagnostic results, and flow sheet. So for this example bow tie item, it starts off by saying the nurse in the emergency department is caring for an 81-year-old male client. And you'll see we have three different tabs here. We have our nurse's notes, our history and physical, and our laboratory results. So under nurse's notes, at 12:15, it says the client is accompanied to the emergency department by son. There's chest pain with diaphoresis noted. Bradycardia and pallor are also present. The son reports client recently outside shoveling snow. Lung sounds are clear, apical pulse is regular, bowel sounds are active in all four quadrants, skin is warm and moist. Emesis 2 times in the emergency department. The son reports one episode of emesis at home prior to arrival. Capillary refill sluggish at 3 seconds. Peripheral pulses are palpable, 1+. Vital signs, temp 98 Fahrenheit, pulse 52, respiratory rate 20, blood pressure 154/86, pulse oximetry reading 93% on room air. An electrocardiogram was obtained per protocol and ST elevation is present. The ED physician was notified. So that's our left-hand side of this bow tie item type. On the right-hand side, It states the nurse is reviewing the client's assessment data to prepare the client's plan of care. And then it gives you directions on how to complete this item type. It says complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing. 2 actions the nurse should take to address that condition, and 2 parameters the nurse should monitor to assess the client's progress. So when I hear about the patient's story, the nurse's note on the left-hand side, I can't help but think the most likely scenario, the most likely condition the client is experiencing is a heart attack, a myocardial infarction. That's what I was thinking the entire time I was reading those nurses' notes. So what I would do here, best plan of attack would be to drag the blue potential condition on the right-hand side, myocardial infarction, drag and drop that into the middle of the bow tie where it says condition most likely experiencing. And then what are some actions to take for a myocardial infarction? Well, when I look at the actions to take, they are noted in green. There are 5 of them. The 2 of them that make the most sense to me would be to insert a peripheral venous access device and then obtain a blood specimen for troponin. Those 2 actions most align with the potential condition of myocardial infarction. And then some parameters to monitor on the right-hand side, the 5 gray boxes. The 2 that make the most sense to me would be to monitor the cardiovascular status and then also to monitor the electrocardiogram rhythm. Those are the 2 that I would drag and drop on the right-hand side of that bow tie for parameter to monitor. I hope this helps. Thank you. Take care.